Wacha kunyamaza kimya na wajiumiza mwenyewe. Usinyamaze, ongea, ongea. Usinyamaze, ongea, ongea. Welcome to the inspiring success stories of the Accelerate project in Homabay County, where lives are being transformed and communities empowered. Join us as we delve into the impactful journeys of individuals touched by this initiative. With support from the Embassy of Denmark in Nairobi, Danida, the Gender Violence Recovery Center, Population Services Kenya, and Population Services International have joined forces to implement Project Accelerate. Accelerate, driven by the promise of the International Conference on Population and Development, ICPD25, aims to achieve zero unmet need for contraception, zero preventable maternal deaths, and zero gender-based violence and harmful practices.
My name is Monzia Dennis. I'm a Programs Officer coordinating GVRC activities here in Homabay County. GVRC, working with the partners under the Project Accelerate, has really impacted on the capacity of healthcare workers here in Homabay County in terms of documentation, referrals and linkages to ensure that survivors of gender-based violence receive the care that they deserve, as well as access to justice for them. Through the project, again, we work with community health promoters. We know they are the level ones in the current system, to make sure that they implement the UHC, the universal health coverage that the government is focusing on. And we work with them to improve referral, identification and reporting of cases of gender-based violence from the community level, because we understand it's at the community level where some cases just go unreported, and if they are well reported, we are able to achieve success even upwards. Lastly, on healthcare workers, issues of documentation. Through the project, we've been able to support the county in printing and distributing of documentation tools in all the facilities that we are supporting in Homabay County, and that has really helped in ensuring that cases of gender-based violence are well documented. For me, as a program coordinator here in Homabay County, we've really had an amazing time implementing the project because of its design, because it's resonating with the people. It's people-centered. When we're dealing with survivor, it's survivor-centered. And we appreciate the donor, the Embassy of Denmark in Nairobi, for this great initiative, for the support that they're giving GVRC and our partners in implementing a Project Accelerate. And we request more support so that we may continue supporting the people of Homabay, because Homabay is ready for the project and they are receptive to our program.
I'm Jared Ouso. I work with the TSC as the Curriculum Support Officer in Nguku Division. Myself, I've learned a lot from GVRC on issues of gender-based violence as far as the learners are concerned. The cases are they were so much notorious in my area of work and in the whole of Homabay County. But when they came in, there are some informations we didn't know. We didn't know what to do. Sometimes we could get issues and we were separate. We didn't even know what to do. But since they came in, we have information. My teachers have been empowered. The learners are empowered. They are able to help themselves and to help the others. We have gotten the skills. We now know if we get a case, we know where to go, we know what to do, and we know how to do it. That information has given us power, and we are so much empowered.
I am Rongo Samuel, head teacher in a comprehensive school. The school was introduced to GVRC program run by the Accelerate in the year 2022. We were taken to a training at Bongo Primary School where 7 schools in Nyarongi Division were trained, Nyere being one of them. Thank you. From the training, we rolled down the Kings and the Queens Club, where the Kings Club are boys and the Queens are girls. So we were bringing boys together. You find in a number of times the empowerment of girls has been done, and the boy child has been left behind. But infusing boys and girls works better than when you take girls alone or when you take boys alone. So we have a Kings and Queens Club in the school that has been a very good achievement to us. A disciplined learner is likely to do well in class. Let me also take this opportunity to thank the GVRC team that has brought to us the speak out boxes that has been put on one of our walls, you will have to see, where the learners can post or write of any problem that they have encountered. So this one also helps us to identify a problem in time and maybe see on ways and means of solving it before it becomes a big issue. One of the key issues that has been hindering the learners present in the school is about brick making. This area is fond of brick making. So you find that boys in grade 6, 7 were leaving school and attending to the brick making. So we liaise with the chief of the area, who is very cooperative and a friend to the school. Our chief baraza was called, and it was made illegal for anyone to use a child who is at the age of going to school in brick making. Allow me to start with thanking the GVRC program led by Bwana Chege and Bwana Joe. These gentlemen are amazing. I will not forget Bwana Mwanzia, who is our coordinator at the county. He is ever working around the clock to see that all the programs in GVRC succeed.
My name is Kefa War. I come from Minyere Junior Secondary School. I'm in grade 8 and I'm a member of the Kings and Queens Club. Kings and Queens Club is the club where boys and girls interact together.
My name is Efe Nyango. I'm in grade 8. I'm in Minyere Junior Secondary School. I'm a member of Kings and Queens Club. I have learned about child abuse and different types of child abuse. We have emotional abuse, sexual abuse, and physical abuse.
We have also learned how to report cases of violence. For example, using Speak Out box.
We have been taught how to prevent child abuse by not walking alone, not accepting gifts from strangers.
My name is Jacob Dollar. Jacob Dollar works with the Teacher Service Commission as my employer, but specifically I work within Homabay County and Homabay Sub-County. We interacted with the GVRC because this is organization which is looking at the gender violence that is facing the learners. And we realized that there are so many cases of gender violence. The learners who are being abused, and the learners sometimes are not aware of how to behave when they have been abused. I want to thank the donor, the Danida, because the Danida has brought in funds, and we appreciate the way this fund has been spent in educating teachers, in spreading, in fighting gender-based violence.
I'm a mental health nurse from the Sub-County Hospital. In this sector of gender-based violence, I am supporting the psychosocial sector, where I give girls health talk. We do sessions to motivate them, to give them hopes for the life tomorrow. We form different groups depending on their age. In these groups we have teenage mothers. In these groups we have adolescents. In these groups we have under 5s or even over 5s, but less than 18 years. All these programs have really improved this life so much. When you check at the parents, some were so hostile when their kids went through this violence. To some, they thought it was a mistake of the children, so they went ahead and became so violent against their own children. Maybe it was because of maybe financial issues, psychological issues at home, that when all this again happened, it really paralyzed their understanding, their mental status, and without this psychosocial therapy, they would have been somewhere else.
The day I got infected was on 5th. I was attending sports in the morning around 7 o'clock. Before I got to the ground, I was called by a man, and before I reached him, he pulled me and raped me. Despite everything, I continued with the sports and shared with another kid about what had happened. The kid talked to the teacher and I was taken to the hospital immediately. I was treated, and after there, they found that I was truly raped. The nurse at the hospital gave me some medications to treat my infection and to also protect me from early pregnancy. This program has helped me with my education. People used to laugh at me and I did not want to be associated with anyone. Every friend I had was avoiding me. This affected my performance in school. Before the rape, my performance was good, but the experience affected how I performed and I became stigmatized. Today, I have more friends and we can share stories. I can tell them how I feel about everything. I keep encouraging them that in case something like what happened to me happened to them, they should not be afraid. They should speak for themselves, because the Accelerate program has taught me I should always speak out. Nobody knows what the future holds, and being open will bring people in their lives who want to help. They can still go to school, make friends, and live their lives as usual. I, as a survivor of gender-based violence, I come from Ndiwa sub-county. I found myself here because one day I was sent to the market to buy some things. On my way, I encountered a man who attacked me, closed my eyes, and raped me. When I got home, I shared with my mother, who took me to the hospital. I received medical treatment and was given a nurse who has been helping me on what to do as a survivor of gender-based violence. The Accelerate program through GVRC has been really helpful. It has been providing me with support to continue with my life and my education. I thank God for everything so far, because when my child experienced the rape, when she was going to sports, she was so afraid and we did not know what to do. When the school called me, I rushed to the hospital and found that the head teacher was already with her and the nurses were attending to her. My name is Jen Atieno Obumba. I have a kid in the Accelerate program. The program has been supporting my child since she had the problem till to date. They have been helping her through gaining strength and knowledge. She has been going to the sessions till the 4th day. The sessions have really helped her, because since she got sick, she has been really scared and afraid. She could not take care of herself.
GBV-SRHR has imparted quite a number of youths in terms of capacity building during capacity building sessions in the community, and that has resulted to youth standing for their rights for themselves on matters advocating and limitation of gender violence in the county. As youth, we need to come out and speak for ourselves. Gender Recovery Center, Violence Recovery Center has also supported the male champions, so that they help people in the community, the other genders in the community, to come out and speak for themselves, so that all these issues are aired and solutions going for them.
Hi, my name is Godwin Ayata Odhiambo. I'm a youth advocate on health issues. I've interacted with the GBV-SRHR Gender Violence Recovery Center. They have trained me personally as an advocate to advocate on the youth as we take role in ending or reducing gender-based violence in the community, and also being involved as youth advocates to advocate for others' rights in the community. Just a recommendation I would love to share here. The program is designed well, but more male engagement is very important. Bringing male from different stakeholders, the border sector, the faith-based, the teachers and other private sectors, just coming together to discuss on ways they can, their role in reducing gender-based violence in the community, because most of the perpetrators, they are male due to masculinity issues. So when they are involved and they have the information, then we have gender equality in the community.
Hello guys, I'm Sharon Obutu. Okay, my role as a youth and as a professional, I'm a psychologist, counseling psychologist. Personally, I've interacted with GBV-SRHR directly as I work at Hope Center in Homabay County Teaching and Referral Hospital. GBV-SRHR has made it easier to create the psychosocial support groups where the survivors can interact, share their experiences, and we also, from the group, we get to learn those that need that special attention.
My name is Seli Manyala. I am a youth champion, an IT expert, and I come from Homabay County. I run Homabay County Peace Network CBO, which is a grassroots CBO, working on GBV and SGBV in Diwa, and I am a glad Kenyan citizen through GBV-SRHR that is able to mentor me and accelerate the work the work of being a youth champion.
I'm called Margaret Onyango. I work in the county of Homabay as a psychiatric nurse, placed at Hope Center, that is a gender-based violence rescue center. And the most cases that we normally see are the sexual gender-based violence cases, mostly with the children, the defilement cases. There have been of a high number. And as a Hope Center, we represent our survivors in court with our PRC forms and Feel Well and the P3 forms, which we present to court for justice for our survivors. Through the support of GBV-SRHR, we have worked well with them. They have been supportive of this department of Hope Center. All the activities here have been supportive. We have been working well with them, and we have been supporting survivors hand in hand.
Jina naitwa Judith Atieno Ongenjo. I'm a CHP Gamba North Village. CHP anasaidia watu kwa village. Kwanza under 5 anasaidia sana. Kama unaenda kuangalia, anatembea angalie watu wanaendelea kwa village aje. Kama unapata mtu wa pregnancy hajaanza clinic, naenda fasensi napeleka, hata under 5 anapeleka. Mtu ana cough after 2 weeks hajaenda hospitali, ana transfer aende hospitali. Sisi ni grassroots CHPs. Ndio nasaidia sisi. Juu ya kama nimepata case, kama mimi nimeshapata case this month. Ndio napiga simu kama deno. Nipigia deno hivyo mpaka hiyo msichana apate haki yake. Ndio naona kama GBV amepata nini, ameleta hiyo kitu ni mzuri. Nataka uendelee vizuri kwa maendeleo. Nimeshukuru sana Embassy Denmark na GBV-SRHR. Tumefanya kazi vizuri kwa hii sub county ya Sobano, na kama kuna uonge sa Homabay County ya Saul ufanye corner, every corner. Hiyo kazi yenu na kazi yetu yaendelea vizuri.
My name is Janet Bonareri. I work with the Ministry of Health in Beta Sub-County. I coordinate GBV activities and GBV-SRHR activities. Those are activities alongside adolescent health and sexual reproductive health in Beta Sub-County. I want to appreciate the job that we've had done in partnership with GBRC in Beta Sub-County, specifically working with the young people in preventing GBV issues, working with the community health promoters to prevent and even sensitize the community on GBV issues, preventive and promoting access to services. We work hand in hand with the GBRC, both in the community and in the facilities, just to see that we are eliminating this issue that we have at hand, GBV, generally for both the young and the old. We know that GBV, someone cannot manage on its own, or just a department cannot manage on its own. We need the multi-sectoral approach. So we really need to intensify this both in the community and at the facility level to bring on board all the stakeholders to just help us eliminate GBV. As we've said, it's a menace that really needs to be eliminated.
My name is Jacqueline Anyango, a teacher at Ndiru Primary School. I'm a champion teacher. A champion teacher is a teacher who represents GBV desk. Is a teacher who helps children, a teacher who stands in for child protection, guiding and counseling children in school. I've been learning on different topics, of which we have days we learn on topics touching on children, more so on GBV, gender-based violences. So far, children have been able to cooperate, and they also bring cases that happen back at home. So for cases that require medical attention, I personally have taken 2 children to Homabay Referral Hospital, and I've also referred another one to Nangwe Sub-County Hospital, and one was particular that was to be taken to the GBRC that was established by this organization. And I'm happy the report that came, they were so cooperative, they were working so well, the children were given proper medication. I truly appreciate the Embassy of Denmark that has supported this program called Accelerate Program. It has been a very good program through GBRC. I am so happy because it has come through, it has taught us so many things.
My name is Caroline Dinya. I teach at Homabay Primary School. Apart from my teaching job, I do mentorship and counseling. I must say that I'm very grateful to GBRC Accelerate team. In my school here, there's a girl who got pregnant in grade 7. This girl comes from an abusive father. He abuses the mother and the other children and her. The girl was really depressed. We managed to trace this girl from her boyfriend who was an underage and bring her back to school. This girl managed to finish her class 8. Once more, I'm grateful to the GBRC Hope Center at the Homabay for providing the psychosocial support for this girl and the medics that helped the girl to go through the family planning method. It will be my request, if they can, support more programs in relation to this, because most schools are really interested in this. Most learners are interested in this. Most teachers are wondering how we are managing to discipline the children without applying so much corporal punishment. At least now I know there's a Hope Center in Mbita, there's a Hope Center in Rangwe, and I can really recommend for parents, for teachers, and everybody with a problem to go to those places. I must say I'm grateful for the information, for the knowledge, and the support that I've gotten for the GBRC. Thank you very much.
Welcome to the Kings and Queens Club. Queens arise. Kings arise. Let's all arise and shine in the world. As a queen, I'm beautiful and blessed. As a king, I'm handsome and blessed.
My name is Melville Adams. I study at Homabay Primary School. I'm in grade 7 and I'm a member of Kings and Queens Club.
My name is Whitney Brandy. I study at Homabay Primary School. I am in grade 7. I am a member of Kings and Queens Club.
My name is Maxwell Khan. I am in grade 7. I study in Homabay Primary School. I am a member of Kings and Queens Club.
My name is Monica Kezia. I learn in Homabay Primary School. I'm in grade 7 and I'm the president of the Kings and Queens Club. Kings and Queens Club involves partnership and encouragement to each other. In our school here, we started it in 2022 while we were in grade 5.
Mtu anajoin akitaka na akiwa na nia nzuri na imetusaidia, imetu-encourage ili tuwe watu courageous.
Tangu to join hii club, tumefundisha kuwa tunafaa ku-encourage others like learners who are in need so that they can be helped, and even we are not supposed to abuse the learners that are in lower classes, like beating them, slapping them, doing bad things to them.
Since we joined this club, we know how to identify child abuse. 1. Emotional abuse, physical abuse, and sexual abuse. The schools that do not have the Kings and Queens Club na wasihi ili muitengeneze ama create. This club has made us to know many things about the society, the things that are happening badly in the society, and it has helped us also to overcome the challenges in the society. As the president of the Kings and Queens Club in Homabay Primary, I thank the GVRC and the Embassy of Denmark in Nairobi for supporting this club and child protection. I request you so that you may take us to other counties to learn more about the other Kings and Queens Club groups.
I request you to start giving sponsors to children who are in need.
I request you to support us to buy many other material for our clubs.
I request you to help us start a project that will raise money to help members of Kings and Queens Club and other children who are in need.
Which school is this?